All right, I think we're live, Adrian. Hey guys, I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. It is adjustment time, and I'm going to take you through with Adrian here all the areas that I'm starting to work on with him. He came, how many visits has it been? Three? Is this 3 or 4 sessions? Have you seen an improvement with your treatments?
Definitely.
And he's into some, you know, mind me saying, grappling, bodybuilding. You were doing, can I say the MMA part? I already did.
Kickboxing, boxing.
Kickboxing. So obviously quite athletic and that. And I'm not your first chiropractor though. You've been to someone else before, right?
Yeah, briefly. Nothing too specific.
And did that help you?
Yeah, it was cool.
So lots of great doctors out there doing what they do and do best. So we had him laying down for about a good 5-10 minutes, traction with some heat. I do that with my patients. Helps to relax the spine before I go in and start adjusting. As we start opening up what is considered the pathways of the nerves that exit out from the spine, we call them afferent and efferent. They go toward and away from whatever tissues or organs that it's supplying. So we're going to start out with an assessment that we do, or that I do in the office, and that's to look for where the interference or areas of misalignment are in the spine. So one of the things that I do is I check the leg lengths and balance and work our way up throughout the spine, and then you'll notice that I tend to adjust the extremities, or like shoulders, arms, hips, knees, ankles, feet, those kind of things at the end. So he's got a short leg, and it's about 3/4 of an inch short on the right side. We consider that what's called the pelvic deficient leg, and his side of most stress. His foot on the left side turns in slightly and points down. Both of them are pointing down, but rotates, or what we call supinate, turns in on this side. Did you have any ankle injuries over here?
Yeah, I rolled it in high school.
How about this one? Not as much?
No.
So on his left side, and I can see that it's more rigid in through the ankle, and I can feel it as I bend the leg out. So a couple things when looking at that, ankle sprains can be an indication of misalignment through the spine, because remember, the communication happens from the brain out through the nerves and talk to the muscles and tissues and cells in the body. So our posture is a direct reflection of some of our habits and stresses and injuries and things that have occurred throughout our life. Are you right dominant by chance, or are you left dominant?
Mostly right.
And when you kick, are you right or left? What is natural for you? Kicking with the right?
I kick stronger with my right, yeah.
With the right one? Okay. So you'll see we bring the legs into what's called, and I could feel the tightness in his legs and the thighs, so I got to this point, I already felt resistance, especially on his left leg. When I bring that leg up or bend the knee, so I'm in position 2 here, you can see some of that shortness decreased. Now I'm going to go to position 3 as well, and I'm feeling a lot of resistance. Did you have injury to that left knee?
Yeah.
So we're going to look at, there's a couple things, obviously injury to other extremities, but also to the sacrum. But see how that right leg comes further?
Uh-huh.
Could you feel the difference when I was doing that?
Yeah.
Okay, so those are some of the tests that we're doing, and I'm going to go right straight to it. A lot of times you'll see the triangle bone here, it's called the sacrum, and there's 5 pair of nerves that come out from the, 5 pair of nerves that come out and talk down to the lower legs. So I'm going to take the apex of the sacrum right here, bring it across, adjust this right SI joint. Now we could also do this test. You've seen me do this before. Raise this leg without bending the knee. That's another way to do the test for the sacrum. Back down. Try the other one. Back down. They came up fairly even. The right one appeared just slightly slower. They were really close. Right now both legs are even. The legs bent further. The left one's coming a little further, so better balance in through the pelvis. And that's where we're working right here, through this area, as we're making the adjustments. We're going to adjust the left pelvic joint. So you see me stabilizing here and adjusting, and you can see my contact on the ischial tuberosity, the bone, your butt bones actually, guys, right through there. And already his legs are starting to feel more relaxed as soon as I'm getting better alignment. What's happening? The nerves are communicating down toward the legs. The soft tissue, such as your muscles, start to relax more. And so that's why people notice that they can stretch or bend or move easier because of that. Okay. Put your right hand on your lower back. So right leg pulled up, so we're checking out right at L5. And you can see the difference in the legs, how they're moving here, where the right one comes further. We're going to adjust his L5. Let's have you lay on this side for me. Okay, good. And let your body come right into me. Good, and face down. That's one way to adjust the spine, where you see it on the side and the force is going through the vertebrae, through the joint on the right side. Some chiropractors use the drop piece. I do that too as well. I change some of the techniques up and this feels better. Left hand on the lower back. We're checking L4 now, though. If I can only bring, too bad I couldn't bring the camera over here right now, but his right leg pulled up significant. It's about an inch difference, so we're testing L4. This is just another way to check, and you can see the difference there. Let's have you lay on your right hip. So when I see that, one vertebrae's gone one way, the other one's gone the opposite. We call it contra-rotated, opposite directions. We're making contact right above L4, or L5 into L4. Good. Face down. You good, Adrian?
Okay.
And we do a scan right through his thoracic spine right here, and you can adjust where I go straight down. And I'm feeling for the area of restriction. And again, this opens up the pathways to the nerves that communicate to the cells and tissues. Now we're going to open up the upper dorsal area. And then actually I'm adjusting toward the upper ribs right here. Good. On your back. So if people have a hard time breathing, a lot of times it'll be the rib area, restriction in the rib or the vertebrae in the thoracic spine. That's your mid-back area. This also, you can feel some discomfort or weakness or tightness in the shoulders. Good. You good?
Yeah.
Breathe. And so what I'm doing now, I'm scanning the area by using my fingers to feel where there's tightness, temperature change, restriction. Sometimes patients will say, hey, I have headaches, I have neck pain. So right now I feel it right at C2, C3. You'll see it bending the head slightly. Good. And adjust cervical spine. I do a nice easy traction through here by hand. Sometimes I use a towel, lift your head, back down, get a nice easy traction through here. How'd you find me, Adrian?
Referral.
Oh, it was referral through someone else. And then we're going to check the hip, and you can see the position of the feet and the legs. This one, okay. Hold on to the table, Adrian. Good. Good. And I want you to sit facing that way for me. Good. Nice and straight. Checking shoulders. One of the things that happens is that people's shoulders tend to roll forward because they do a lot of sitting. So we're going to adjust the shoulder. Good. And other one. Let your head drop all the way down. Good. Relax. Sitting up nice and straight. Checking elbows. So I adjust full spine, full body. Good. Good. Nice arch into the lower back. We help correct some of the posture of patients by helping change some of their position, what they think is normal, helping them adapt to a new position. So breath through your nose, out through your mouth. Into the nose, out through your mouth. How was that? Great. Awesome. Anything you want to share with the viewer audience? You're right here.
It was awesome. Thanks, Doc.
You're welcome. Absolutely. It's been an absolute pleasure working with you. Guys, I'm Dr. David Warwick, Warwick Chiropractic in Lacey, Olympia, Washington. Thank you for watching.